a phrase ringing in my ear from this morning, from the minister from Barbados. 2030 is tomorrow, that sense of urgency. And also that need to join the dots, particularly to join the global with the local. All very well for goals, commitments to be made from on high, but how does that translate? And that's what this session is all around. So we're going to be really starting to unpick that. We'll want to talk about how actors around the world can really collaborate really effectively to drive action. We're going to talk about how data can be used, how accountability mechanisms have a role to play, and what that means in practice. And of course, we're going to be talking about the role of technology and capacity building and where the gaps might be. But the lessons you're going to hear are coming from the front. They're not from commentators or spectators. They're from esteemed individuals who've been there and learned these lessons firsthand. So the point of the session is to really just deepen our understanding about these joining dot moments and really trying to make that happen. So to set the scene, somebody we've met already this morning, but not to share a keynote, so we're absolutely delighted to welcome him to our stage. Ambassador Walton Webson is without doubt a global leader dedicated to advancing the quality of eye health for all. Indeed, to take it from being a health topic to being a development topic, raising its profile not just at a national level, but at an international level. And what that has meant is mobilizing action and commitment around the world. It is an absolute honor, as it always is, to welcome to our stage Ambassador Walton Webson.
Greetings and good morning to everyone. Ladies and gentlemen, colleagues, excellencies, señora y señores, buenos tardes, good day. Let me, Ollie and friends here, begin by, first of all, thanking our esteemed friends from IAPB for bringing us together and organizing this global meeting. I am also indeed very grateful and very happy to be in Mexico and to thank APEC and the government of Mexico for hosting us and their warm welcome to all of us. It is a pleasure to join you, all of you here today, and it is a great pleasure to see the increased numbers of participants with us from Latin America and the Caribbean. This is a step forward to the last events and shows the coming in of our colleagues from Latin America and the Caribbean to join this global movement for the transformation of health services and eye health challenges that we all face in changing and making this change, this global change, and being part of this advocacy group today. Colleagues, friends, the world is interconnected at an unprecedented extent. We are locked in together. We are locked in together politically, economically, environmental changes. We can no longer see changes as being contained within national boundaries. We know that when we have been speaking for several years on climate change, and we have moved from just the impact on small islands to the global impact, so too as the system of health. So too are the challenges we face. We do not face eye health challenges by ourselves in our small environments. We face these globally. There are billions of people in our globe who needs our service and need to understand the change on eye health. While the challenges are fully inclusive, so too must be the solutions. In our interconnected world, the significance of global policy frameworks and the advocacy efforts to develop and deliver them cannot be overstated. In fact, we cannot do it alone. These policies, crafted by the institutions such as the United Nations, the World Health Organizations, all serve as indispensable tools in our pursuit for universal eye health. They act as a catalyst for change, ensuring that the needs of the marginalized and vulnerable are met through comprehensive and inclusive policies, therefore inclusive services. They establish a united framework with international standards and targets, ensuring that all nations work towards common objectives. You know, the very modern phrase, we are in this together. This is what we mean. This alignment enhances coordination, cooperation, facilitating more effective and efficient progress at the national level. For change must not be at what I like to call the 10-foot pole. Change must be on the ground at the national level. As many of you know, eye health historically received very little attention at the global level. In the last 5 years, in 2018, we founded with friends the United Nations Friends of Vision, and that group began to change the trajectory at the international or global level and began to raise the profile of eye health on the international agenda. We felt it through this movement we began to consolidate and strengthen support and share knowledge from the eye health sector, and since to bring it into the broader development sector, we have achieved in the last 6 or so years what I believe to be extraordinary progress. We have seen real difference. We have begun to hear people truly begin to speak, and at the highest level, about eye health. And to that I want to express my appreciation right here and now to the many government ministers who were involved with us last year, to Prime Minister Brown of Antigua, Prime Minister Motley of Barbados, and others, leaders from Nepal, and we also had leaders from Samoa and so on who were engaged with us. So I want to express our public thanks. The Minister of Health adopted a very ambitious global target in eye health in Geneva, and we take note of this because those are the global changes that we are seeing. The United Nations General Assembly adopted, and you have heard of that this morning already, the landmark resolution on eye health. That, my friends, was the first time that eye health became a major discussion within the United Nations. We also saw eye health being included within the discussion on universal health. We saw the change in road safety to include eye health. So we are seeing at the highest level the engagement of leaders discussing the question on eye health. But it can't stop there. It is not important to be there unless it is taken down to meet people at the local level. What we want to see in transformation is local people speaking about, I love my eyes. I want to see local people speaking about the need for eye health services within local communities. UN agencies like the International Labour Organization, like UNICEF, like UN Women, all of these agencies are emphasizing your work emphasizing the things you are doing now, but let's take it down also to make sure that our communities are equally beginning to embrace our effort here, your effort, and the work that you are doing. Advocating at the global level is, as I said, is not merely a formality. It is a strategic imperative. And therefore, that strategy is to start at that level and get it down to national level. My friends, it is through this intersection of coming together between global, regional, and national that we transform our lofty goals and our high ambition and the commitment of senior officers and leaders. It is through that we can begin to see worldwide change to make a difference. This exchange between global and national must be reciprocated at all levels so that we can truly find ourselves truly embracing services in eye health within all sectors of society. I mentioned ILO, I mentioned UNICEF, I mentioned UN Women, all representing broader sections of our society. It is the heart of, this coming together is the heart of bridging national and local and making that divide no longer a divide, but coming together as one. This reciprocal relationship ensures that global frameworks are informed by on-the-ground realities and represent accurate data and information that will help us to truly begin to manage and truly begin to draw down. We want to see by 2030, using our summit as a marking point, we want to be able to see that change that the resolution of 2021 spoke of. We want to be able to use these meetings and this upcoming summit as major landmarks to help us measure this, our continuous eating into what is a major global challenge. We cannot have billions of people outside of the global economic and social space. We must bring all in. As we move forward, let us reaffirm our commitment to leveraging global policy frameworks and the national progress. Let us amplify the voices of national actors. Let us make sure that the voices of the people at the local and community levels are part of our chorus calling for change. Let us collaborate to ensure that global policies provide a clear roadmap that national action can implement as effective at all levels, and that these strategies remain major landmarks in our action towards making sure that we can get rid of avoidable blindness by 2030. Let us embrace collaboration. Let us embrace cooperation. Let us embrace that expansion of taking our work from amongst our own choir and including a global harmony that will sing the same songs of removing avoidable blindness. Let us do so not tomorrow, not 2030, but let us begin to do so now. I thank you.
And let me just say, on behalf of all of us, Ambassador Webster, of course, you're the permanent representative for Antigua and Barbuda to the United Nations. Of course, you co-founded the Friends of Vision Group. And of course, you're the global ambassador for the IAPB. And for all of those roles and for everything you've shared with us today, we just want to say a collective thank you. Love that idea of an ever-increasingly large choir, a harmony of voices. As long as we can use technology for the auto-tune, I'm in for that as well. But then a very powerful metaphor to bring us through the morning. Now, speaking of getting everyone involved, we're going to introduce our next guests. I was thinking of introducing them this very second, but that would mean they'd have to take part in the quiz I've got up my sleeve. And I don't think that's fair, because it might put them in a bad mood for my questions. So they get to stay seated, but everybody gets to play in this next round. Serious questions, quick format. Here we go. Are you ready, everybody? You can play this at home if you're tuned in. It's absolutely fine. It is quick questions, but you just raise your hand. We're not even using the app. Sorry, team. We're just going to raise your hands and show me the answer. Right, here we go. Question number 1. This is really quick. True or false? The implementation of the UN's Sustainable Development Goals commits countries to develop national action plans that integrate global health policies. I'll say it one more time. The implementation of the UN's Sustainable Development Goals commits countries to develop national action plans that integrate global health policies. Raise your hands if you think that's true. Hands up if you think that's true. Fair enough. Okay. Quite a lot of people. The ambassador may be abstaining. We just don't know. He might be checking his TikTok feedback. We don't know either. Hands up if you think that's false. Okay. All right. It is true. Give yourself a clap if you got that one right. Well done. All right. Fine. All right. Here's another one. Here we go. True or false? UN General Assembly. I mean, this isn't the latest pub quiz. I've not got this from there, I tell you. True or false? UN General Assembly resolutions and political declarations are legally binding after member state adoption. Are legally binding after member state adoption, Minister Humphrey. Is that true or is that false? Raise your hand if you think it's true. Are they legally binding? Raise your hand if you think it is false. Well, the majority are with the program. I'm afraid it is false. They are not legally binding. Right, onwards. We're on a roll now. Now, I've got some multiple choice. I don't know how I'm going to do this one, but let's do it anyway. Right. Question number 3. Okay, raise your hand for your answer choice. That's how we're going to do it. Okay, the WHO Eye Care in Health Systems Guide for Action provides a step-by-step guide for implementing what global policy? Is it A, raise your hand when you hear the right answer. Well, you could wait. I'll do them twice. A, the UN Convention on the Rights of Persons with Disability. Anyone else? B, the Sustainable Development Goals. Or C, integrated people-centered eye care. Well, it's by a high margin, isn't it? You've got it absolutely right. It's C. Of course it is. Right, Alarcos will be thrilled about that. Good. One last question, and then we'll get our honourable guests up. Okay, I think this is our last question. So raise your hand for your answer choice. What is the name of the mechanism that member states can use at the global level to report national plans, policies, and progress on eye health? Is it Universal Periodic Review? Is it voluntary national reviews? Or is it the monitoring and reporting mechanism? I'll say it one more time. Universal Periodic Review. Okay. Is it voluntary national reviews? Okay. Or is it the monitoring and reporting mechanism? Well, you were right in the middle there. It is actually B. It is the monitoring and reporting. Thank you, everyone. I mean, ABC have just been on the line, say they won't be screening this as their primetime quiz show, but don't worry, we'll play it again next year anyway. Thanks very much. Give yourselves a round of applause. Very good. I think we keep going. Right. Come on. Thank you, everybody. I mean, unbelievably, all 5 guests got a full house on that quiz, so congratulations to them. I know they're so happy about that. We've got an incredible regional representation on this panel, and it is about translation. It is about how we go from global to local. But I suppose if we flip that around from time to time, it's how the local feeds up to inform the global too. So let me just tell you who's here. Ryan Toews? Come on. Toews. Ryan Toews is the Executive Director of Fundación Visión out of Paraguay, and it's great to welcome him back. Obviously had a great session with him in Singapore. Welcome to you, Ryan. Dr. Oteri Okolo is the National Coordinator for the National Eye Health Program at the Federal Ministry of Health in Abuja in Nigeria. Very nice to see you, Doctor. And what an honor to welcome a guest from right here in Mexico. Dr. Maria Martina Perez Rendon is the Secretary of Health and General Coordinator of Health Services in the state of Querétaro in Mexico. Welcome, Doctor. Needing little introduction, Mr. Brandon Artong is the Director of Policy and Advocacy at the Fred Hollows Foundation. Always good to see you, Brandon. Welcome. And thanks to the Fred Hollows Foundation for being our strategic partner for this event and such a trusted ally. Thank you. Ms. Grace Entreatsu is the Senior Global Advocacy Advisor for West Africa at Sightsavers. Welcome, Grace. Grace's fan club in the house. But we're all each other's fan club here. I loved your contributions at our breakout yesterday, Grace, so good to see you again. Okay, my apologies. We're going to go really rapid fire through some really important questions which deserve a lot longer, but I promise they will be thought starters for everything else. I want to talk firstly, we'd like to talk about supporting national strategies with global frameworks. And Dr. Oteri, I'm going to start with you. Let me put the question very, very specifically. In what ways have global policies and frameworks from the WHO or the UN influenced the development and implementation of national eye health strategies in your country? So you've seen that conversion in practice. Tell us.
Thank you very much for that question, Ollie. So in Nigeria, global policies and strategies have been very helpful in advancing Nigeria's journey towards ensuring that eye health is a priority. For instance, it has helped frame eye health in Nigeria, not just as an eye health issue, but as a social development and economic issue. And so that has helped to put eye health on the front burner. Beyond that, it has provided evidence-based strategies and set targets for helping Nigeria develop its first national eye health policy and then its first strategic plan in print. And that plan will run from 2024 to 2028. And beyond that, it has also set targets, like I said earlier on, for implementation of interventions at the local level, at the level of the states. It has also informed budgetary allocation. So there's now a budget line for eye health, and also informs annual operation plans for eye health. Beyond that, it has also provided, standards and best practices for implementation of strategies, even at the level of the states. Beyond that, also, it has also provided technical tools and resources to help Nigeria integrate eye health into the wider health sector and also into non-eye health sector, for instance, education, transport, therefore ensuring more wider stakeholder involvement in eye health and improving access to eye health, for instance, the school at the level of the schools, at the primary health level and all of that. So it has really been critical for Nigeria to translate, those global policies and strategies to ensure, implementation in Nigeria, ensure improved services at the country level. So that has been very helpful for us.
And thank you. And to enable you to keep hitting the ground running on these things, is there anything you would say to the world leaders to say, here's the thing to bear in mind, almost to go further, to clarify even more perhaps?
Okay, so for the eye health sector globally, we will want for that sector to support local actors in eye health in Nigeria and other countries, especially in resource-constrained countries, to be able to collect context-specific data that will feed global policy so that those global policies are relevant to us at the local level to ensure local action, and then also to set up surveillance structures to collect this data, to ensure that this data is both timely and that is accurate. And we believe if there's that feedback mechanism between the local actors in our health and in the international level for policy, that will also help. And also to ensure that we are part of the process of developing global policy.
Right. So let's build on this theme of going from global to national with you, Dr. Maria. How do you implement global policies at a national level in a way that means they're implemented and sustainable too?
Buenos días a todos y todas. Muchísimas gracias por la invitación. Agradezco la pregunta y precisamente escuchando las palabras del embajador, él hablaba de ver estas políticas globales aterrizadas en lo local. Y les quiero compartir un poquito de lo que hemos estado trabajando en Querétaro y muy alineado a lo que se mencionaba anteriormente. Querétaro es un estado pequeño de la República, tenemos alrededor de 2.600.000 habitantes, es que nada que ver con esta gran ciudad de México. Sin embargo, hay la suma de voluntades. Creo que esto es muy importante para poder aterrizar el tema de la salud visual dentro de las políticas estatales. Existe el compromiso por parte del gobierno estatal, en este caso representado por su servidora, en trabajar en uno de los temas principales, hablando ya propiamente de ceguera, en la prevención de la retinopatía del prematuro. Y esto también no sería posible si no se suman otras voluntades, como son la participación de organizaciones de la sociedad civil. Hay un trabajo muy interesante, hemos logrado que los hospitales públicos que atienden a la población más vulnerable, tenemos la expectativa que para el mes de enero podamos decir que el 100% de los pequeños, o sea, no tengamos ceguera por esta causa, ¿no? Por la retinopatía del prematuro. Otra política que se ha implementado en el Estado y que seguimos año con año y también con la suma de la participación de instituciones u organizaciones de la sociedad civil es la atención de las cataratas. Cada año, aparte del programa permanente que tenemos en nuestros hospitales, tenemos jornadas donde llegamos a atender un promedio entre 200, 300 personas y el resto que no pudieran ser atendidos en esas jornadas se siguen trabajando de manera permanente en nuestros hospitales, que afortunadamente se tiene el servicio y la forma de resolverlo. Y otro componente que también consideramos importante y nuevamente insisto con la participación de la sociedad civil son programas de dotación gratuita de lentes a pequeños y que entonces nos permite pues abordar temas de mejora del aprendizaje, del rendimiento de los niños, de cambiar la vida de esos pequeños y con estas organizaciones de la sociedad civil. Y el DIF estatal, una institución también del gobierno del desarrollo integral de la familia, tiene un programa permanente y en jornadas de dotación de lentes, ahí sí ya sin discriminar edades, adultos y a niños. Creemos que con esto abordamos parte de los principales problemas asociados a la cuestión de ceguera y de los errores de la refracción.
Really helpful, really powerful, and great numbers as well. And humbling to think a small state of 2 million people. These are very big numbers, so thank you for the work that you're doing. I wanted to draw on…
Sorry, Ollie, can I just I need to grab my…
Brandon, please.
I just need to grab my device for a translation. If someone can grab my bag over there, if you don't mind, Brooke or someone.
Yes. Yeah, we'll get you that device come through, Brandon. Yeah, so particularly reflecting on the work in that state, but also of programs to deliver lenses for free, glasses for free, especially to children across your state in Mexico. Really powerful, thank you. I wanted to draw a little bit on what Dr. Oteri was saying, Grace, about data, about the importance of data. And really, it is back to joining those dots, isn't it? Because you need national data to inform global policy making. So how do you communicate very technical data in a way that has to bring on board very different stakeholders? Where do you begin to answer that?
Thank you very much. I think data is very good at really giving us an idea as to where we are in the journey. But the way it's communicated, especially drilling it down to what is behind it, the impact thereof. So data is good, but in order to be able to really get what it is and make impacts with data, is to be able to drill it down to the impact behind it, the people behind it, and actually what the data means. Because it is then that you really see the impact thereof. And so also coming from an advocacy perspective, I would say that knowing your audience, so getting to know who it is that you're communicating that data to, and couching it in such a way that they find it relevant, and it's couched in a way that it makes them move to action, and not just add it to just the statistics. Statistics are only as relevant to the extent to which it galvanizes action and is able to make people see the issues and act accordingly.
So this is, and Oteri, I'm going to bring you in on this, but this can often be, what you're saying is it's about how you frame the data to tell a slightly different story depending on the audience. So to put you on the spot, is there an example of how reframing in that sense has made the argument more powerful? What comes to your mind?
So in sitting in the conference, one of the things that I've been thinking about is, so we are all speaking about the same thing, and it's basically like speaking to the converted. How do we really pick data, make it make sense to the politician, for instance? In most of our countries, at the country level, every country is looking at how to achieve the SDGs. And until it is achieved, I mean, there are statistics to show that we need to achieve this and that. So really looking at your audience, if you're looking at using, making use of the VNR process, for instance, it will be key to couch that data to make the government officials realize that we need to achieve these eye health targets, to be able to reach the SDGs. Whereas if I'm speaking to another official, looking at that official and understanding their interest. For instance, if we're speaking to a funder, for instance, you probably are going to make a business case out of that data.
Yes, understood.
And really knowing your audience and developing the data and couching the evidence to make sure that it does make impact. And sometimes using case study is very powerful because then it drills it down to the personal level, because at the end of it all, we really want to make impact at the personal level.
And Dr. Terry, feel free to come in on data, but the thing I really wanted to quiz you on, because what's going to be going through a lot of guests' minds is you've got the necessary breadth of the global policies, but then you've got the rapidly shifting concerns, priorities, challenges at the local level. So how does the sector, if you like, ensure that these policies can be more adaptable, if you like? How do we sort of square that circle?
So we need to be very agile and respond. Like I mentioned, collecting data, we need to be very agile. The sector needs to be very agile in responding to the data. And that means we need to form very strong linkages and connections to national eye programs or people at the local level working in the eye health sector. and ensure we're in touch with them and have that continuous exchange of data. I'm sure when we do that, that will be able to, help us to do that. Then speaking to which we were talking about, because I had a personal experience, we need to be able to humanize data. We need to show the face behind the numbers, because numbers can just look like numbers. But if we can tell the personal stories or eye health stories, that will make huge impact.
Right, thank you. Now, I want to talk a bit about, we'd like to talk about accountability. So Ryan, I'm going to get you on that. But based on what you've just said, Oteri, I want to bring you in, Brandon, because in advocacy, you have to call to the head and the heart. And data has to have a role to play in that. So would you mind just riffing on that briefly for us, where those numbers help you to really make the case to some very senior leaders?
Yeah, thanks, Ollie. And I think Grace outlined it really, really well as well. It really comes back to this point about framing, I think. And whether it's data, whether it's personal stories, whether it's, content-heavy policy, it's all about how you frame the messages to the audience in which you're speaking to. So I really think that having a clear sense of what you're gathering data for and who you're messaging to, and the same data can be framed in a different way to different audiences, depending on what you're trying to achieve. So I guess the key thing is really around framing and being very clear about who you're speaking to.
Yeah, thank you, Brandon. So all very well to make these commitments, but if we haven't got the mechanisms to hold the different stakeholders accountable, Ryan, then we're sort of we're sort of stuck at first base, really, aren't we? So how do we use monitoring and evaluation frameworks to our best advantage? What have you thought? What have you learned so far?
I have that. I think that has many sides. From one side, there's your local social actors that are in the sector, and I think that has to be a joint effort. So you have to bring them all together. What we did is we created with the national, with the Ministry of Health and all the national actors, a committee for vision, a national committee for vision. So then we get the actors together. And when we have the actors, then we have to decide, okay, what we want to do. So currently we are working on a national eye health plan as a committee with all the actors. So it's a plan, so you have your priority set, you have your key performance indicators, you have your goals. And I think after that, it's just the other side, and then after that, we will need to compare how is every institution and every actor part of it and where we're standing. And when we have that, then the other side will be, this national plan will be guided, oriented by the international standard and monitoring system, so a framework. So I think that's the place where we think it will connect. And then you can, so we as an institution and as a country and as a sector, we can see what we want to do, what we are doing, how we are doing on a national level, and then compare it on an international level.
So presumably, though, that is impeccable in theory, but in practice, there will be blockers and real challenges. What are they?
Yes, especially in some countries at least, the availability and the quality of the data, it's still one main issue. Also because there are so many actors, the coordination of this work could be a challenge. And then adapt the ideas and the goals that are in the standard that are expected internationally to a local level and a local reality, because then every actor, every country and every actor has to do it, right? So I think that would be something where will be some discussions made, right?
This may be totally wrong, so shoot me down. Is there something softer in here as well around attitudes to sharing data, not wanting to be exposed or potentially embarrassed by the current baseline in your particular part of the world, or have you not come across that at all?
Yeah, there will be maybe some of them, especially when we were compared maybe with the international standard. Yes. Yeah, so on a national level, we can think we are doing fine, and then we compare it, then yes, I think there will be some internal work to do with ourselves.
And Maria, your attitude on, or your experience on sharing your data to benefit global programs, to share so that others can learn and to be part of the bigger picture.
Yo creo que, bueno, concuerdo con los compañeros, el hecho de compartir los datos nos permite pues priorizar, identificar áreas de oportunidad, y también concuerdo en este tema de que los datos tendrán que ser manejados dependiendo al auditorio que vayan dirigidos y lo que queremos obtener de ese auditorio. En el caso particular de Querétaro, nos apegamos a un sistema nacional de información, todo está ahí transparentado y vamos muy de la mano con pues ir implementando todas estas estrategias que están incluso dirigidas desde estos escenarios para poder incidir en ellas. Y también creo que en esto de poder sumar las voluntades, pues es necesario partir de la información. Y eso pues está en esa información que se está generando todos los días en la práctica de todo el sector, ¿no?
Yeah, so almost that thought of it, almost as close to a live dashboard as possible in that sense. Brandon, can I just pick up on something that Ryan has mentioned specifically there, which is about sort of frameworks and evaluation. What was the specific, well, there were a couple of things, actually. One was on frameworks. So voluntary national reviews. I'd love to get your quick take on those, and also the WHO's global targets. How should we be viewing those? And particularly on that first one, on the voluntary national reviews, and you might, forgive me if no one needs to remind you might just need a quick reminder on that.
Sure. So the voluntary national reviews are, member states have agreed to report on their progress towards the Sustainable Development Goals, or the SDGs, twice within the 15 years. So those reports are basically national level reports that they report on their progress. I think this is a really important point because, and which links to the second part of your question around the global targets, we as a sector have done really well thinking about the need for data to drive improvements in program delivery and how we manage and plan for programs. Now that is absolutely essential. But one of the areas that we've quite neglected over time is seeing how important data is for political engagement. We know that in terms of global data for the two indicators, they're around the effective coverage of cataract surgery and the effective coverage of refractive error correction, that the data is not really there. So we're really trying to build that now. So I think the key message there is to, number one, to see how data is so powerful and necessary for monitoring progress, for setting ambitions, and for essentially bringing the club along, if you like. And the second thing, just on the voluntary national reviews or the VNRs, is that that's an opportunity for us to be visible within the more broader development space that Aubrey Webson, Ambassador Webson speaks about. That's a mechanism for us to be visible, be part of that agenda, and bring eye health into that frame.
Because if that doesn't happen, I mean, that is pretty troubling, isn't it, Grace? Because, I mean, I'll just give you an example, and forgive my ignorance on this. How confident are we that we are connecting in education, for example, the provision of eyeglasses with learner outcomes and results with career outcomes? Do we have a golden thread running through those data sets at the moment?
So on that, I was actually going to comment on how important the VNR process is. So it is really one way of galvanizing action at the national level, and also ensuring that we mobilize action, finance, resources, and bring together the various actors to really work on the targets. And so the VNRs are key, and I think that it is one way of ensuring that we indeed get the 2030 goals achieved.
Right, Grace. Well, I've noticed you haven't answered my education question, so I'm going to ask you an even tougher one. But it's one you're going to like. Because the reality is, you're having to work with such a variety of stakeholders. So I think it would help just almost paint us that picture, because in a national implementation effort, just remind us how you're influencing them, how you're including them, and amongst friends, what are the challenges? What are the barriers? What do you find in practice?
Including these targets at the national level.
Yeah, the critical stakeholders at a national level
Oh,
for the
right.
implementation of these global policies.
Thank you very much. So in our implementation, one of the key things that we do is to galvanize all the stakeholders, right from the development of whether it's a project or an initiative, bring them together so that we do a lot of co-creation. And then at the end of the day, we also have sometimes a steering committee of some sort that really ensures that all the key stakeholders are at the table,
yes,
inputting and feeding into the implementation of the project. So at the end of the day, we are sure that there's that kind of ownership and that people can speak to what it is that we are pushing for. And that makes it very easy to influence and push for change. Because then, then it doesn't look like somebody's pushing it down your throat. You were part of the process. You understand it better. And I think that's one key way of really seeing that kind of result.
So, amongst friends then, have you met with resistance?
Oh, yes. There may be some resistance every now and then, especially when it comes to the fact that, I mean, we work in resource-constrained environments. So there are times that eye health may not necessarily be prioritized. And I remember having a conversation whilst I was here that sometimes it's just because they think that eye health may not necessarily kill immediately. But then using data, evidence, and drilling it down to the impact of ensuring good eye health and services, and the lack thereof as well.
Indeed. So who will build on this? Brandon, please.
Challenges. You know, we've been trying to engage specifically at the country level to have eye health included. And I'll give you an example. So last year, Vietnam had opted to report on their progress. Our country director had engaged the eye health coordinator in Vietnam. What we hear is that, number one, that the eye health coordinators are not in the loop in terms of these types of processes. Number two, that when you engage in the right ministry, normally within the either President's office or the Prime Minister's office or an area specifically around SDGs, they don't understand why you're talking to them. Partly because eye health does not feature at all within the SDG monitoring framework. That monitoring framework is almost like your contents page for what countries should report on. So that you can go through a number of different scenarios, but ultimately it's going to require a shift in mindset of who your key stakeholders are.
Yes.
And to build relationships on an ongoing basis with those areas through the health department, through the other departments with which you may be working, for example, education or so forth, but also specifically with the departments with responsibilities for the Sustainable Development Goals. And it's a process, but relationships are key.
Thank you. I'm just going to stay. We've only got about 5 or so minutes left, but I want to stay on that thought of resistance, just because it's very real and very often not spoken about on the main stage. So, have you got something that your average contributor, not that anyone is average here, wouldn't be bold enough to be blunt about on the main stage, about the sort of resistance you encounter day to day, and this could be unspoken, right?
Yeah. So in Nigeria, having everybody on the table is very critical, and that they're on the table doesn't mean that you won't have resistance. Now, for instance, there are certain strategic things that we've tried to do in Nigeria. For instance, integrating primary eye care into primary health care. We have had resistance from professional groups because it's viewed as like you are taking away some of their turf, some of their part of their job. But then we have been able to at least make some inroads by letting them see that the people in the rural areas, 70% of Nigerians reside there, and many of these eye health professionals will never go there to work. So we need to be able to have implement the skill sharing policy to train primary healthcare workers to offer these services. So we've had resistance specifically in that, and in other areas, for instance, presbyopia, addressing presbyopia at scale. You know, you could have resistance from professional groups if you want to have non-health workers, for instance, screen people in the population and dispense glasses.
And thank you, Dr. Derry. And now, Maria, in Mexico, when you're trying to engage very different stakeholders, civil society, could be the private sector, could be your colleagues within government, could be the public. What have you learned about resistance that you've had to face and how to combat that?
Sí, yo creo que este punto que se tocaba antes de la información y los datos, si lo sabemos manejar de manera adecuada ante estas audiencias donde podemos tener resistencia, son fundamentales. Platicaba hace un momentito con el doctor Eleri López, el impacto económico que implica todo el tema de la salud visual. Cuando vemos eso, creo que cuando hablamos del bolsillo a todo mundo nos mueve, ¿no? Pero también cuando le ponemos nombre a la persona, y les comparto rapidísimamente de esta institución, esta organización que nos está ayudando con la dotación de lentes de forma gratuita. Ellos mismos que lo están promoviendo se quedan sorprendidos de manera favorable cuando el niño les dice, ya una vez que le ponen sus lentecitos y el niño les dice, oye, así se ve, pues, de que notan el cambio y eso los alienta a seguir colaborando. Entonces creo que también el ir compartiendo experiencias exitosas en estos escenarios donde identificamos actores con resistencia nos permite romper esa resistencia y que se sumen a este tema tan importante que yo creo que la cuestión visual es la discapacidad más frecuente en el mundo.
Yeah, and it's that visibility of progress, isn't it? Showing what works, making it very clear. Thank you. And painting using the numbers as well. Ryan, I'm going to ask you to be brief, but on a very important topic, and that's around the importance or the potential for scaling up using technology, but also capacity building more generally, because we've got some very powerful global policies that need to hit the ground all across the world. So where would you like to start on that? Do you want to talk a little bit about the potential for technology to do that scaling up?
Okay, yeah, I think those items are interrelated, right? So we want to have impact, we want to bring the service and solution to patients, and therefore we need capacity building, we need to be affordable, so we use technology to do that, and then we have to secure funds. So it's a mix. In Paraguay at least, and I think in Global South too, what we are now trying to do is to use more telemedicine, use technology to make an economy of scale of the service of the doctor itself, right? So we are using that. We have good experience now with ROP programs, where we visit public hospitals on a weekly basis and every day, a different hospital. IA is not yet there, it's just starting with that, but I think that will make the services more affordable. We are also, yes, so we need that, and we use some of this the cameras that we'll use for telemedicine will also be used in these vision centers, something that we are, I think it's not a new concept, but is vision centers outside the big cities, in the rural areas, more remote areas. It's something that is for us, it's a kind of a game changer, especially for the low-income population in the South. And when we do that, we also do a lot of outreach campaigns and trips between 15 to 30. And to do that, we use a lot of alliance. So we built alliance with many stakeholders. There's the public infrastructure, health infrastructure, also hospitals, municipalities, state governance, and also we are closer, every time more closer to the private sector. If you have been in Singapore, what we call it an ecosystem perspective, where we have patients, we have the social services, health services, we have fundraising, and then we have the business sector involved in this task.
How, though, do we embrace technology that remains accessible and doesn't leave the disconnected behind? How do we square that?
Yes, accessible. Well, I think it's, from our perspective, what we are now trying to do is more with alliance with private sector. This is one of the things, public and private, but it's through alliances. It's not a work that we can face by ourselves, right? So we have to be in a joint effort.
Thank you, Brian. So I'm going to pause briefly. We've covered a lot about translation, around advocacy, around challenges on the ground, around use of technology, around national frameworks. But what's not being said? That's the question. So firstly, thank you to our 5 brilliant guests. And stay with us, because we've got more questions for you. But I'd like us here in Mexico City just to turn to our neighbor and maybe reflect on what's been said or what's not been said, but must be said if this is to be a brilliant session that it deserves to be. So why don't we take 1 minute with our neighbor just to reflect briefly, and then we'll come straight back with your questions and feedback. Thank you. Okay, everybody, welcome back. Welcome back if you're tuning back in or here with us in the room. So number one, will you just join me in thanking our 5 brilliant contributors here on the stage for their insights? But let's not let them off the hook with that warmth of appreciation. We should feel free to fire more questions at them if you'll bear with us, everybody. And I'd love to hear your questions or your pithy reflections as well. And I won't force you. We'll come straight to you in that second row. I won't force you to say who you are or where you're from if you don't want to, but we'll run a mic around. So I'll try and look across the whole space. But do raise your hand if you'd like. And don't forget, here our theme is, how do we go from global to national to local? But spinning the whole thing around, how do we make sure that everything that's happening on the ground gets properly fed up to the global vision, right? So that is our theme. Let's come here in the second row, and then I'm looking around for other reflections and contributions. Thank you. Right, we'll go behind. Thank you. Welcome.
Thank you very much. Thank you very much. It's okay. Thank you very much, everybody on the panel, and thank you very much, Ollie, for the opportunity to speak. Dr. Gillian Cochrane from Collaborative Vision. One thing I've been hearing in this couple of few days is the concept of scaling up. And scaling up is all very well and good if you have more people to provide the more services. And that seems to be a perennial block in many of the countries. And it's coming from, I think it would be beneficial to start working more directly with departments of education, because it's coming from the schooling level, that the caliber of students leaving school cannot meet the standards to go into universities. So if we're scaling up with more primary eye care, which means that there'll be more screening, yes, we can put glasses on the face immediately with ready-to-clip glasses or ready-mades, which will cover 80% of the needs, and we're just talking about the refractive error element. But we're going to find a lot more eye health conditions that need to be seen by clinical people. And we don't have enough clinicians to provide that need. So we're increasing a burden on already overstretched human resource capacity in countries. So we do need to look at getting more students coming out of school, meeting the hurdle requirements to get into university, to do a medical degree or another health practitioner degree or other diploma. But we need that capacity building. And often the barrier is the school student competency at school leaving level isn't at a level great enough to get into universities.
So you're talking there specifically about the talent going into the eye health sector,
Yeah.
and making sure that that pipeline is strengthened.
That pool
So
is small.
we might get a reflection on that, but the point is very well made. Let's just go right behind you there. Welcome.
Want to go straight into it? Sorry. Hi, Kevin White. My question is more about the, we know that we're talking about task sharing, and some people call it a dirty word, but so we cannot, as Jillian was saying, there's just not enough capacity in the eye health sector to kind of meet some of the needs that we're talking about, the billions of people that need eyeglasses. So I'd like to get your reflection on the thoughts of task sharing, the inevitability of task sharing. Ryan, I'd love for you to talk, if you know about the DRC program that you have with task sharing with Reinhold Dirksen, if you have any thoughts on that, and just see where that's going. In the expansion of services, simplified by doing what normal medicine does. The normal medical community is seeing how far we can push things ethically, legally, and efficiently to a lower level of care to meet the demand and meet the need.
Yeah, and I would love to be just a tiny bit clearer. You're talking about task sharing here? Just to tell us a little bit, just help frame that for us.
Yeah, so task sharing, and how do we grow the capacity of the eye health community to kind of embrace the technology for task sharing, the triaging, and so on, yeah.
Yeah, got it. Okay, so two questions. We will take more, but will anyone speak to that first very good point about the talent coming from the schools into the workplace? Will anyone offer me a reflection on that? Thank you, Brandon.
I was wondering if someone else is putting their hand up first. I'm not going to answer that question specifically, but I wanted to say that your question really goes to the heart of the question of bringing eye health into the broader development agenda. And if the SDGs really are interconnected and indivisible, meaning that no one SDG is more important than the other because they are interrelated, the question for us, and I don't have the answer, is how do we need to support things that are not directly in our wheelhouse in order to lift all boats, which will connect back to us. So again, I'm not giving you an answer, but I think your question belies potentially the next step for us to consider as a sector.
Thank you, Brandon. Dr. Maria, yes, just as I was hoping, if you'll speak to the talent question. Gracias.
Yo quisiera compartirles que en México recién hace algunos 2-3 años se amplió el número de plazas para la formación de médicos especialistas. Y muy concretamente en Querétaro tenemos 2 espacios donde se están formando médicos especialistas, uno de la iniciativa privada, el Instituto Mexicano de Oftalmología, y otro el Hospital General de Querétaro. No sé si sea suficiente y concuerdo que pues prácticamente en todas las especialidades el talento siempre hará falta. Y creo que entonces tenemos que buscar estrategias de cómo poder hacer llegar este servicio especializado a quien lo necesita con toda precisión. En el caso de los pequeños que se filtran para dotarlos de lentes, si él es con personal entrenado, de forma que si identifican alguna situación que tenga que ser revisada por el especialista, el médico especialista se turna a este médico especialista. También no sé si vaya a ser suficiente, si lográramos llegar a todos los escolares, no sé si tendríamos la capacidad de poder atender a todos aquellos que requieran la atención, pero por lo pronto hay esa cadena de detecciones para poder llegar al especialista.
Maria, to be very blunt, have you got the talent you need coming out of Mexican schools and colleges to fuel your health sector?
No, creo que no. Creo que, insisto, al igual que en otras especialidades, seguramente estará haciendo falta, Pero creo que también algo que yo mencionaba y que es fundamental es buscar esas alianzas, el poder ir sumando otros actores de la iniciativa privada, de organizaciones de la sociedad civil, el sector salud en su complejidad, para poder tener un alcance mayor.
Yeah, so another thing that complicates the problem in African countries, should I say, and lower middle income countries, is the fact, the reality of brain drain. So even when the medical schools and residency trainings churn out the specialties required, they tend not to stay in country. But I think that is why task shifting and task sharing has become very important in Nigeria. And that is why for the primary healthcare workers, we have domesticated the WHO primary eye care manual to be able to offer training. So we're looking also at other options for training these healthcare workers. So we're looking at technology, using mobile technology and internet training platforms to be able to offer this training. So right now what we do is we do a 2-day training, an in-person training, but we know that Nigeria is a huge country, so we're trying to see how we can work with international partners to be able to do an online kind of training to improve their capacity to be able to offer primary eye care at the primary level.
And really, we could riff on that for a lot longer, but thank you, Dr. Ote. There was an offer of a question on that side, if it still stands, and I see you there as well. If we can get a microphone just on stage right, just over this side. Yes, of course. Yeah, we'll absolutely come to the ambassador. Thank you. So we're going to the far side, and then I'm going to come right into the middle to Ambassador Webson. Thank you. I haven't forgotten you there.
So I'm always alerted to the issue related to data, because data is what tells the stories. Data is what we need to demonstrate differences. But there's a lot of challenges with data. And I heard when you were talking about education how you avoided that conversation a little bit. And the things that I worry about is data actually should come from a central location, so international down to national. But data can't be international as you interpret it, because on the ground things vary. And if you look at the education piece, to be able to identify strong data from individual educational programs on the national level is challenging, because there's different levels.
Yes.
So I'd be curious how you all see the issue of data and how to ensure we can talk the same language with the numbers.
Grace, do you want to have a crack at that?
I thought I nicely avoided that.
I know you thought that.
So one of the ways to ensure that, data is a bit sanitized is standardizing it. And so ensuring that there are standardized ways of collecting data may help. So in eye health, in some of the countries that we work in, for instance, we ensure and we train people for the data collection, as well as work with the system that keeps it, so that at the very least, you get the right data going in to get the right pictures.
Yes.
And then if you talk about the fact that data is coming from international to the national level, I'm thinking at the national level, we need to really use that data to inform international policies and things like that, because it is at the national level that really action takes place and impact is.
Yes.
So getting the right data from the national level is key.
Thank you, Grace. And while we've got the mic still in the audience, can I ask the questioner, what's your answer to your own question? What do you think we need more of?
So I truly believe we need to be collecting the data in the same manner and reporting it consistently. There needs to be a central depository, and you have to vary it because of the confidentiality, and it needs to be aggregate data, but we need to be able to assimilate this data together, and you can't do it if we're all collecting different things in
Who's
different
best
ways.
placed to take the lead on that?
I would say that should come from IAPB or WHO. It has to come from a resource that really is respected.
Right. Thank you. We'll just get a final, I'll ask you to wrap that in a moment, just here, and then we'll come right to the front to the ambassador. But there was a final, if we can just make this pithy, if you would, forgive me, because I'm going to finish on time.
Okay, it's Fiona from Sightsavers. I'll try and make it pithy. Grace and Brandon, your answer may not necessarily be pithy. I guess to go back to what we were talking about the global and the national level, and we saw last year with the high-level meeting on universal health coverage and getting reference to eye health in that. Next year we have another high-level meeting on non-communicable diseases and the importance of kind of talking to people both outside of the eye health sector, within the health sector, but also within the broader development sector, and how we should be doing that at both global and national level.
Does anyone want to reflect briefly on that? Brandon, I know you're going to have some final reflections, but did you want to reflect, or Grace, briefly on that?
How to reach outside. I don't think there's really a simple answer or one that's not hard work. I think it comes down to relationship building. But relationship building, again, I think I said earlier that you only choose to reach out to other places if you've made a mindset shift that those other people are relevant to you and you're relevant to them.
Yes. Yeah, really, really beautiful way to reflect that. Thank you, Brandon. Ambassador Webson, you've been reflecting on these contributions. Sir.
Thank you very much. Thank you. This is off, okay. Right, thank you very much. There's a lot to unpack, but I'll take a couple. I'll start with what I think it's Brooke was talking in terms of the data. In terms of the response on data, what the small islands have decided to do is to set up a global data hub. And in fact, there are SDG data hubs that it's been set up through the UN. And those data hubs, like the global data hubs of small islands, which we set up in the Small Island Center of Excellence, would be one such unit or one such mechanism that can be used to harness data, and the eye health sector needs to get involved with that data hub in terms of getting data, training people to use it, and then using that data towards its end. So that's something to think about, and as it continues to link on broadening the scope of engagement. Similarly, the question of training. Now, none of these developing countries, and particularly, I know, in small islands, we are ever going to be able to produce enough of the high-level technicians that we need to meet the challenges that we're talking about. So we have to, again, focus on interrelationships and also focus on connectivity using technology. We've got to begin to see how technology can help advance the things we are talking about in terms of eye health, and therefore our training and our even some of the technical work can be done efficiently and effectively through technology. And we got to see how that's why we talk about moving outside of just our field and including and using technology as an instrument in helping us to address some of these problems if we are going to bring the numbers down and address the issues that we are always going to be short. Just one point on the training. I think somebody on stage referenced it. You may train as many doctors and so on, and that's a long-term vision, of course, but you may train many people, but in small islands and in developing countries, you're going to have a significant attrition. They migrate. But in today's world, even though people might migrate to London or United States, you can still have them serving Antigua or Nigeria or wherever because of technology. So let's broaden the thinking, let's embrace other areas, and let's begin to see ourselves as a much more inclusive service within the eye health sector.
Thank you, Ambassador Webson. I do feel bad, Oteri, because there was a reflection hanging, but please tell me. Because otherwise I'll be feeling bad for the next year.
No, I just remember that we have not quite addressed the issue of education and probably other multi-sectoral data that we need to be able to enhance eye care services. So I'm saying the way we have used global, shall I say, policy to ensure change in this, within the sector, we also need to have that interconnectivity at the global level with education, with labor, with transport, other sectors to be able to bring that change towards the local level so that we can have that collaboration at that level and have useful data that can improve on eye care services.
Yeah, amazing. Yeah, you've just given me an idea. Our former Prime Minister, Gordon Brown, lost his sight in one eye. UN Global Envoy on Education, former Prime Minister. It's joining these dots, isn't it? Right. Thank you. That's given me an idea. I'm going to ask Brandon for a final reflection, but not before I say a massive thank you to all 5 and indeed 6 of our fantastic contributors. Thank you again very much indeed. Brandon, would you like to reflect from the lectern or from your seat, sir? Yeah, come.
Cool. This is further away than I thought. I should have just done it over there. Thank you to my fellow panelists. It's a real privilege to share the stage with you, but also Ambassador Webson. It's always an honour. You're a mentor of mine, so to be on the same stage as you is always an enormous privilege. So thinking about the final comments, I was reflecting on probably the most common question I'm asked, which is why work on in this global space, on these global resolutions, and do they really make a difference? And I think to the second question, well, in and of themselves, they do nothing. To the first question of why, I think it's really about it being quite personal. It's personal to me for a few reasons, but probably most given that I have a condition that can't be treated. It's called retinitis pigmentosa. And it's meant that about 10, 12 years ago, I've been living with blindness, and about 10 years before that with a severe vision impairment. What that means in practice is that I've got a 19-year-old son, and I remember back when he was 5 and he was doing a school play and he was dressed up in a donkey suit. Well, I actually never saw that. I never saw him on stage. My daughter's 16 years old now, and I go to her basketball games every Sunday. I've never actually seen her play. And so it's that kind of personal piece. I'm lucky enough to live in a country where I've had access to skills development and assistive technology, where I'm able to maintain employment and a standard of living because of that privilege. Now, when you look at the fact that 90% of people living life with similar experiences to mine, but of course with a billion different variations given their own circumstance, but not because they have a untreatable inherited retinal disease, but simply because of where they live, who they are, and how much money they have, because they've not had access to the services and treatments that we already have to hand. It's not right? It's not right. And this issue, as we know and we've heard of the last days, is not getting better, but it's getting deeper. That we know that by 2050, potentially there's going to be more people with severe vision impairment and blindness by double. So we need to do something differently. We have no choice. So it's personal for me, but I know it's personal for each of you as well. And I think that one of the beauties about the ISL this year, Insight Live, is the personal reflections. We've had so many of them. It's been really heartening to see. But I know for each of you, there's a reason why you're here in this room, why you're working in this sector, why you're pouring your lives into the work that you do. So the why is really simple. because it's personal for us, that the situation is unacceptable, and that to do something different is a moral obligation on us all, right? So this global stuff, this global policy work, is really just a signpost towards change. But the pathway to change is only paved through the work at the country level and on the ground. That's where it lives. The global agenda really is two things, really. It's quite simple. That we need to make eye health part of universal health coverage through advancing integrated people-centered eye care. And as Ambassador Webson's spoken about already, it's about making eye health a sustainable development issue. What that means in practice is about asking yourselves questions. How can I integrate better into other health services? How can I make whatever I do putting people at the center? How can I reach out to other sectors to bring them into our cause and for us to help them do theirs? And what can I do to feed up so that those global signposts are better targeted and showing a clearer direction? That's what it's about. Now, you're not alone in this process, of course, and the IAPB is many things, but probably its most powerful asset is its convening power. Use the IAPB to convene, to facilitate, to provide guidance in the work that you're doing in country. So just to close, I want to potentially close on something a bit controversial, and that is to disagree a little bit with the great Aristotle, where he said that the whole is more than the sum of its parts. I like that, but I'll put a spin on it, because I think that the whole is only made possible through the sum of its parts. So translating global advocacy, I'd invite you to choose to be part of this journey, and together I think we can really make this global agenda truly live. Thank you.
Thank you, Brandon. Thank you so much, and thank you to the Fred Hollows Foundation for your strategic partnership of this year's summit. Ladies and gentlemen, Brandon Artong, thank you very much indeed. Thank you for helping us join the dots, and a final thank you to our brilliant guests. Thank you.